After I had the CyberKnife radiation, they decided that they wanted to change my treatment up. So they wanted to put me on another treatment called a TDM1, which is a more systemic and kind of breaks through the blood-brain barrier, which is what I was, I guess, having problems with. It just wasn't breaking that seal, if you will. And I needed something more systemic. So they decided they wanted to change up my treatment. Even though my body was stable, they still wanted to an all-in-one kind of thing. So they changed up my treatment to TDM1, which is trastuzumab, lapatinib, Femara, Xgeva, and Faslodex. So but then at that time, they also found on another scan, because I was in there for scans constantly, they found on another scan that I had a little mass on my adrenal gland, my left adrenal gland. And so I had to go in for an adrenalectomy. And while I was in there, they said, well, we might as well do an oophorectomy, which is clearing out in everything but your uterus. So my ovaries, my fallopian tubes, everything that gives off hormones or estrogen. So I had that 2-for-1 surgery and recovered from that. And that's really when I full on started the TDM1. They wanted to introduce a neurosurgeon and a radiology oncologist. And so that's when Dr. Fetchy, my neurosurgeon, and Dr. Kirkpatrick, my rad onc, came into the picture. They had been monitoring and kind of watching the one, especially the one in the cerebellum, because that one was the bigger of the two, and it was kind of more aggressive. It was kind of changing shapes and moving around a bit and kind of making them uncomfortable. So they wanted to monitor it. So they did, and watched it for about 6 months.